Over the past 25 years, Queensway has gone through some radical changes.
Going from a small sort of 3-4 surgery practice into the massive clinic that we have today.
We've changed and progressed to do more private dental care, looking after patients with more complex needs who may require cosmetic treatment or dental implants.
The equipment and materials that we're using now compared to then is completely different, and the levels of team and training that we work with is on a really such a high level that we've really moved on.
But I think most importantly, the thing that's changed is the team's ability to deliver the kind of expertise that I think patients deserve and should expect.
25 years ago, virtually all practices in the UK would have been working under an NHS contract. At that time it was very much fee per item, and dentists, the kind of old stereotypical drill and fill approach to what they were doing. Dentists would see a problem and then just deal with it in the quickest way that they could manage.
Now in the 21st century there have been some changes over the years for the NHS, and there's a lot more range of dentistry that we can deliver outside those services, and that allows us to use some of our skills on training with implant MSCs and diplomas in sedation to allow us to utilise some of the latest equipment and technology and still manage to care for patients in a holistic way.
One of the biggest changes is that we've all got better at what we do now because of our training and education.
The symbiosis and synergy between facial aesthetics and dentistry is so strong these days, and because many of our patients are concerned about their smile, they're also concerned about other aspects of their face. As dentists, we have such special skills. We've honed our skills for years to perform miracles in a confined environment like the mouth. We can now apply those skills to the face as a whole and provide a complete rejuvenation like no other profession can.
I think the highlight of my career has been the wonderful opportunity to collaborate with a huge range of the dental profession here at Queensway.
I've been at Queensway for the last 11 years, just over, and I think the highlight of my career in that time was probably undoubtedly becoming a partner first and foremost.
Along with 3 of my other Queensway partners graduating from the Coyce Centre of Dental Excellence, this was a culmination of 3 years of travelling backwards and forwards to Seattle, learning from one of the world's most pioneering dentists, Dr. John Coyce. It was absolutely amazing.
Been on courses all over the world and worked with and been lectured to from some of the best dentists in the world. But honestly, the team at Queensway is fantastic, second to none. And every day I come to work I feel fortunate to work with great people around me. We all have patients' best interests at heart, and if that's the starting place, then only good things can come from that.
So the trends in dentistry are really always changing. We're surrounded by equipment and materials that evolve all the time. One of the biggest changes was about 12 years ago we invested in some cutting-edge ceramic technology that you could deliver ceramics at the chairside, and for a number of reasons that the equipment, the way that worked, wasn't as reliable as we hoped. So we left that and went back to just working with the dental technicians. More recently we've now got the ability to take 3D photographs from X-ray scans and share those with the technicians and start to plan individual complex cases from the very beginning of the patient journey. Bringing that in a way that the patient can understand what the outcome might be is a really powerful thing, and really is a great improvement.
The only thing I can really put my finger on is that I used to have a tooth gem right here. Thankfully, those days are gone.
I think the future is really bright for Queensway. I mean, we are a growing team with a growing number of patients coming to us from all over the country, if not all over the world, in fact. So it's a great time to be a dentist, and I feel really fortunate to have the technology around us to be able to look after patients and provide amazing dental care. So fantastic, and Queensway's leading the way in that.
We're also looking to develop a couple of new implant surgeries specifically for myself and Will Carter, and that's going to be dedicated for some of the more complex cases and and implant surgery that we have for patients coming to Billingham.
Invest in the technology, the infrastructure that we have in terms of our team training. Our experiences is growing all the time, and that puts us in a great place to continue to deliver the best possible care and hopefully continue to build on that reputation of being the, if you like, the go-to place in the North East to come to for dental care.
I believe Queensway's future's bright. It's a stable organisation with some amazing people who work here. We are committed to delivering a first-class service to both patients in Billingham and further afield. In Jesmond we've opened a new practice which is very exciting for us. But Queensway's here to stay, here to innovate, develop and do the best it can to provide a first-class service.
Future's bright, the future's copper.